is emergency medicine specialist from Henry Ford Jackson Hospital and IEP Urgent Care, Dr. Jacob Sinkoff.
Hi guys, thanks so much for having me.
Good morning.
My pleasure.
Great to have you here.
Thank you.
So we just came off a big holiday weekend.
Yeah, so the weather has changed in Michigan, it seems like finally. While I was working, my wife and my 17-month-old were at home enjoying the weather with hopefully the rest of the Jacks. And I know people have been putting up with allergies.
Oh my goodness.
Absolutely terrible.
So I played golf yesterday, and the wind, and I don't get too many allergies, and all of a sudden, it's coming out of nowhere. Can that happen when the wind is blowing 50 miles an hour like that?
Yeah, for sure. Anything that actually disturbs the environment. So rain actually helps a little bit by pulling all the pollen down, but if you have a thunderstorm with wind, it actually makes things worse. So wind, everything like that will definitely increase pollen, and this year's been an especially bad year. Yeah. The good news is usually this is about the worst time of year, and things, seasonal allergy-wise, things should be kind of toning down a little bit. Most of the pollen we see this time of year is actually from trees. So once the trees are done blooming, it should hopefully tone down a little bit. But it's difficult to be outside sometimes for the allergy sufferers.
Yeah, I was on the Falling Waters Trail, and I have this new allergy symptom, which is cough. I mean, it just starts and it just doesn't stop, and that's been. I'm almost afraid to go outside now. Yeah,
and we've seen that a lot, and it's hard to differentiate the symptoms of, hey, is this my allergies? Is this a cold? Yeah. We're seeing the flu. I've seen every day. I've been working over the past holiday weekend. Every day I see someone that comes in with the flu or, of course, COVID. And people are worried about going to work and trying, spreading COVID, or it's like, is this just allergies? So for that, I would for sure recommend getting the COVID quick test. Being able to get that test, so you're not worried about. You can tell everyone at the office, like, this is just allergies, guys. You don't have to worry. Going to urgent care, getting symptomatic care. But I left my car out last night. You guys notice how much pollen, if you leave your car outside, it feels like I had like a half an inch of pollen sitting on my car that I had to get off this morning. So, we're not alone in our suffering of the allergies.
So the demand on the ER and urgent care on a holiday weekend, it's typically more than the rest of the...
So it really depends. Usually the worst day is actually today. The day after a holiday weekend is usually the worst. Working this weekend is actually really busy. But usually holiday weekends aren't as busy. Usually they wait till the day after. People to come in, and obviously we're 24/7, and we're happy to see people whenever they want to come in. We always have someone there and are happy to see them. But we were actually pretty busy this weekend, which is good. We're starting to see our outdoor injuries more now. People are having cookouts now, fires, water.
Fireworks.
Yeah, summer in Michigan, right? Lakes, adventure. What should people be aware of when they're, if you're going to be spending 8 hours on the water with your family, kids, drinking? I mean, there's a lot of risks.
Exactly. So this is a newfound worry to me with a young child, and I live on a lake in the area also. Water safety has kind of jumped up to the top of my list of things I think about, not only as a physician, but just a parent or someone that likes to go out on the water. There's so many different things to think about. Obviously, being on the water all day, it's hot. And if you're in the water, you don't feel like you're getting dehydrated or anything like that. So obviously staying hydrated with lots and lots of water. And I know people like to have a couple adult beverages, which is okay. We like to have a good time, but maybe having a glass of water in between every other adult beverage is really beneficial. People really underestimate how dehydrated they get, especially on the water.
Yeah, and your strength is not where it normally is once you're in the water, right?
Exactly. People underestimate how much work it is to stay afloat in the water, and some people are better at staying afloat than others. But it kind of brings me to another thing is wearing life jackets.
Right.
I know everyone's great swimmers, but especially I always recommend paddle boards, kayaks, canoes. Even if you're a good swimmer, I personally don't think just having the personal flotation device in the canoe is enough. I think you should really have it on. Even if you're a great swimmer, medical emergencies happen at any time, and if something happens, you pass out, you go in the water. Being able to float is so beneficial, and we see so many accidents like that where we don't really know what happens, and someone's a good swimmer, and unfortunately, they drowned. And it seems like these drownings are becoming more and more prevalent. Just in Lake Michigan alone, last year, 53 people drowned.
Wow.
It's
just
crazy.
In Lake Michigan.
Just in Lake Michigan. And a lot of that has to do with the tides and the currents and stuff like that. But every year, and we're blessed in Jackson to have so many lakes that people are able to enjoy. But we see it all the time. So definitely something to think about too.
For sure.
And as an emergency physician, it must be frustrating to see injuries that could have easily been prevented by wearing the life jacket or by using a bike helmet. And I mean, there's so many things and we all know, right?
Yep. And it's hard. It's just like, hey, I'm just going to do this for a second. I just want to quit. We're jumping topics to winter skiing, but I always heard the statistic that most ski injuries happen on the last ski run of the day.
Yeah.
And I'm sure it's true. And it's the same thing with kind of this. It's like, I'm just going to go for one quick lap around, a lap around the lake, or, we're getting the end of the tubing day where we're really going to whip the kids around this time. And it seems like that's when a lot of the times the injuries happen. I've noticed that too at work. It's usually near the tail end of the day when we start to see all this, where people, haven't stayed hydrated. That's just when it seems to occur, for sure. So.
Yeah, and that's when the ER is busy too.
Yeah, absolutely. Yeah, kind of near the tail end of the day. Usually we have kind of our big bolus of patients between 5 and 7 a lot of times also. So, one other thing I'd like to talk about that I just thought of is diving. We see these injuries, and every year we have a very tragic just diving case, and it seems like a lot of times they're guests, where it's someone doesn't live on the lake. They're visiting someone, and they dive into the lake, and not being familiar with lakes, where the deep parts of the lake are. So if you have guests, just keep them. Hey, it's probably not a good idea to dive ever into a lake, even if you're familiar with it, because you don't know if there's a tree stump or something like that. But that's another common injury we see every year that's so tragic, that can be so easily avoided, is just diving headfirst into a lake.
Yeah, there's no shortage of videos with people jumping off the porch roof or.
Oh my goodness.
Yes.
Yeah, don't do that.
Yeah, don't do any of that.
Don't do any of that.
And that's one of those times where, alcoholic beverages are involved, which they're okay to enjoy, just in moderation and staying hydrated for sure, along with all that. So. Yeah,
and of course, this is the busy travel season too, and unfortunately, it's the time we see the increase in car accidents, and I guess travel is back to pre-COVID levels.
Even higher. I was just reading a statistic about air travel. There's more people flying now than before COVID. There's been so many cancellations and stuff like that. So with flights, probably the road traffic's going to be even higher. Obviously, always wear a seatbelt. And think about how far we've come with seatbelts, throughout the years. And we're getting there with bike helmets, like using personal flotation devices. So I can never say it enough. Please wear your seatbelt. Almost every tragic accident we see in the emergency department with a car accident is someone that's not wearing a seatbelt. And you see these pictures of people that come in and see their cars afterwards, and they're wearing a seatbelt, and they walk out of the emergency department, and their car is in like a a 2x2 foot cube, and they walk out of the emergency department because they're wearing seatbelts. And with the advent of airbags and all these curtain airbags, have really helped with that. Obviously, no drinking and driving too. We're getting to that season too, where I worry sometimes driving home from work, especially at night, in the evening. So please call a cab, have a friend come pick you up.
Yeah, it's unfortunately it's the time of year too. We've got graduation season,
Yep.
Weddings, summer parties, the
Yep.
holidays. It's like the perfect storm for
Yep.
all these things to happen.
Motorcycles are out, so keep your eye out for motorcycles. They're just so hard to see. No texting and driving. You glance down for 5 seconds. You know, it's too late. It really is. So all that safety is things we need to think of throughout the summer.
Well, thanks for working on the holiday weekend.
My pleasure. Proud to serve Jackson.
And good to see you. Thanks for being here today.
My pleasure. Thank you for having me.
You bet. From Henry Ford Jackson Hospital and IEP Urgent Care Emergency Medicine Specialist, Dr. Jacob Sinkoff.